Are you involved in any hospital committees that have as their purposes determining the cause of why people die or pass away?
Sure, I do. So outside of being in the trenches, taking care of the patients at the bedside and figuring out what's going on and trying to discern what might have happened, I also participate on a committee that meets regularly. And what we do is we review all of the cases in the cardiac intensive care unit. We look at any near deaths and any deaths. And we review looking at the medical chart and all the evidence to try to figure out what might have happened for quality purposes, to figure out if there was something else we could have done.
Hello, everyone. I am
to
just
improve
watching
our overall knowledge of
the
field.
trial. I'm going to just give
Do
my
you have
feedback.
experience
So
with
if you guys want
patients
to
who
watch with me,
sometimes, pass
we are
away
here
during
watching.
what's
I have some
called
free
clinical
time today.
Yes, so I also participate in clinical trials where we try to determine if a certain medication or a certain device is worthy of being approved to help patients. In the course of clinical trials, sometimes there are deaths. And so in my role, I have sat on committees, and our purpose on that committee is to review any deaths that do occur, look at all of the evidence to figure out, number one, why did the death happen?
I'm
And
good. What's
number
up,
two,
Michael?
and sometimes this is one of the more important parts to distinguish, was it a cardiac cause or was it for a reason that is not related to the heart?
Well, bringing us further home to this case, do you have experience with cardiac patients who die from what we call?
So they got a. Seems like they just got another expert on
Oh,
here.
most
Just
certainly I do.
it's starting to seem cumulative
Yeah,
now.
so because
How many
I
experts do you
am
got to tell me that he
the
died of
cardiologist who takes care
something?
of patients in the intensive
What?
care unit, having low oxygen levels is not uncommon. A lot of different disease processes can cause it, and low oxygen levels can be very detrimental.
I wonder why they haven't this guy
Some of our
testify.
patients
Is he going to
require
testify that Floyd
ventilators
didn't have a
or
heart attack?
respirators. And so in the course of caring for these patients,
Let me shoot this
sometimes
link.
they succumb to their illness because their body is not able to get enough oxygen.
Do you ever have to determine cause of death in the heart transplant context?
Yes. So in the field of heart transplantation, what happens is when you get a phone call that somebody has died and they want to be an organ donor. So what I need to do is look at the case from afar, but try to look at all the records as closely as possible to really sort out how that individual died, and if there's any issues related to their heart or other parts of their body, to make absolutely sure that that heart would be a good match for my patient who we're trying to help. And so that's another element where you have to be really meticulous as you go through. You don't.
Hey, good morning. Good morning.
Right? I mean, the stakes are way too high.
We've heard from a couple of pathologists in the trial.
Yeah, hopefully,
Does your job require you?
I'll be able to talk to Uncivil Law. I think we have a show. We have a show Wednesday, so it's Wednesday we'll be on arguing about
cardiac
this stuff.
pathologists actually pretty closely, perhaps more so than other general cardiologists. I mentioned that I take biopsy specimens of the inner lining of the heart, and I send those specimens to the pathologist to review under the microscope.
You guys can hear everything well, I hope.
That include reviewing autopsies. One of the things that I have learned over the years, and I've been actually taught this by the cardiac pathologists, is that while a pathologist can look under the microscope and give us very important information, I work with a world-renowned cardiac pathologist who reminds me nearly every day, please tell me as much clinical information as you can. Put it in clinical context.
Oh, I see what they're doing now.
And interpret what I see under the microscope is very much influenced
so
by the clinical story.
The whole
so we work
confusion between the two, the ME versus the pathologist versus the pulmonologist, they're trying. This guy is going to supposed to close that door. He's going to explain that away.
Truly get it right.
Just a little bit more background, Dr. Rich. Have you published in the field of cardiology?
Yes, I have.
Can you generally characterize what kinds of publications and how many?
Sure. So to date, I've published more than 200 combined abstracts, original manuscripts, reviews, and book chapters. And the topics have been pretty wide-ranging in the field of cardiology, from coronary artery disease, hypertension, which is high blood pressure, congestive heart
That
failure,
should help.
and another disease actually called pulmonary hypertension.
And what is pulmonary hypertension?
Pulmonary hypertension is high pressures that are specific to the blood vessels in the lungs. All right, so when the blood flows from the heart to the lungs, if the pressure is high in those blood vessels, we refer to that as pulmonary hypertension.
Doctor, would you generally describe for the jurors what is cardiology as a science?
Sure. So cardiology is the study of the heart at the most basic level. It's the study of how the heart functions, what happens when the heart develops disease, pretty much everything heart related and how it interacts with the rest of the body in order to sustain life.
How do you go about assessing a patient with a cardiology issue?
Sure. So when you assess any patient with or without a cardiology issue, but in this context, a cardiology issue, you typically begin by meeting the individual in the office, taking a history, doing a detailed physical examination, reviewing all the medical records and the charts, looking at past procedures and tests that they may have had, and sometimes speaking to other colleagues who you are caring for that patient with together, and then sometimes ordering your own tests for evaluation and diagnostic purposes.
Are some of your patients referred then from other cardiologists?
Yes. So because of my specialty in advanced heart disease, close to half the patients who are I'm seeing in the office as new patients have been referred to me by other cardiologists, typically.
Hold on. The reason why I'm stopping it here is because they're just laying down foundation now for his testimony. They want it seems to me that they have this guy up now because they want to clear up any confusion. If the ME says one thing versus the pulmonologist says something, this guy's supposed to clear up all that confusion. Okay, let's talk about the heart. And that's why he talked about his interactions with, the people who deal with the dead versus the people who deal with the living. And now they're doing it, they're giving his background to lay his foundation for his opinion. So that's where we're at, just in case so everybody else understands what we're listening to.
In the community or in the region, and I will assist them in consultation to figure out what's going on and what we need to do to help that individual.
In the ICU, do you take care of patients who have problems beyond the heart?
Yes. So, it's interesting. As a cardiologist, I think part of the important reasons why they require of us to do that internal medicine residency training is because no organs work in isolation. And so my patients who have heart disease, who also require the intensive care unit, they will usually have issues with many other organs, their lungs, their kidneys, sometimes their brain, their liver. And so you really have to be adept and have a really good understanding of not just the heart, but all the organs of the body and really how they interact.
Dr. Rich, let's talk about your role in this litigation.
Here we go.
How did you come to be involved in this case?
I was contacted by the state of Minnesota, and I was asked as a cardiologist if I could review the facts of this case to help determine how Mr. George Floyd died.
Have you been compensated by the state for the bulk of the work you've done on this case?
No, up until my time here now at trial, I have not received compensation.
Oh, another freebie, huh?
Probably for a couple of reasons. Mostly, I felt that my job as a cardiologist could really help inform the facts of this case. Every year, I take on a number of professional activities without compensation. I actually think it's a duty of our field. And so in this case, I felt I can make a meaningful contribution to the medical field.
The altruistic doctor.
So for your,
I'm doing it because I'm a good guy.
Here at trial, are you being compensated at $1,200 per day?
Yeah, it's $1,200 a day while I'm missing work back at home.
That's compensation, $1,200 a day. I like that.
So let's talk about then your opinion or opinions in this case. Before we do, could you tell us what work you did? What did you review before forming opinions in the case?
Sure. So I was provided with a lot of evidence to look through, but mostly I looked through the medical records interviews, all the videos that were provided to me, and the autopsy report.
Did you review some journal articles as well?
Yeah, as I was formulating my opinion and creating my expert report, I also looked up journal articles and embedded them into my report for references.
Have you formed any opinions in this case to a reasonable degree of medical certainty as to the cause of Mr. Floyd's death?
Yes, I have.
Would you tell us your opinion or opinions?
Sure. In this case, Mr. George Floyd died from a cardiopulmonary arrest. It was caused by low oxygen levels, and those low oxygen levels were induced by the prone restraint and positional asphyxiation that he was subjected to.
Damn.
Well, let's discuss your opinion, Dr. Rich, and let's start it with just a general discussion of the circulatory system in the heart. So I'd like to talk about the right side of the heart, left side of the heart, and also the alveoli. Would you start off and just tell the jury, just remind them, what are the alveoli?
Sure. So you might remember hearing about this, but the alveoli are those grape-like structures that are
That's a good point,
at the very
Fiona.
bottoms of the lungs. The alveoli is where the actual gas exchange occurs, meaning that is where, when we take a breath in, oxygen gets across the lungs and into the bloodstream, and then the carbon dioxide that needs to leave the body crosses that same barrier into those alveoli. So when we take our deep breath out, that's how the carbon dioxide is removed. So it's the alveoli of the lungs that serve that purpose.
And again, what does the heart do in the body?
What does the heart do? Well, the heart is the major pump, of course, of the body. The best way to think of the heart, in my view, is to actually think of it as two pumps, sort of a right side and a left side. So if we start with the right side of the heart, after all that blood got pumped to the body and is coming back to the heart, blood is always returned to the right side of the heart. So this is now blood that presumably does not have much oxygen in it, and it needs to get more oxygen. So the right side of the heart, its job is singular. It is to pump blood to the lungs, to those alveoli. So the blood, when it heads towards the lungs, it can pick up that oxygen that it doesn't have right now, and it can deliver carbon dioxide and other acids and waste products to be expelled from the body. Once that blood from the right side of the heart has picked up the oxygen that it needed, it sends it to the left side of the heart. Now, the left side of the heart gets all the glory because it is what then pumps all of that oxygen and nutrient-rich blood to the entire body, meaning to the lungs, to the kidneys, to the brain, to our muscles, to deliver oxygen, because every organ, every tissue of the body needs oxygen in order to function. And then once that process occurs, it repeats back to the right side and so forth.
And what happens if the lungs can't deliver sufficient oxygen to the heart? That is, if there's a low oxygen situation.
Okay, well, the heart is only as good as the fuel that it's provided with. So when that right side of the heart sends blood to the lungs and says, okay, can I have some oxygen, please? If there is no oxygen there, or not enough oxygen there, there is nothing the heart can do to extract more from the lungs. So it has to take that deoxygenated blood, that blood that does not have enough oxygen, and pump it to the left side of the body. The left side of the body says, okay, this is what I have. This is what I'm going to pump now. And so what ends up happening is if the lungs don't give enough oxygen to the body, the heart then has to pump insufficiently oxygenated blood to the tissues of the body. And that's when problems occur.
Well, then returning to your opinion, cardiopulmonary arrest caused by low oxygen, induced by positional asphyxia. What caused the low level of oxygen in the case of Mr. George Floyd?
Well, in his case, it was truly the prone restraint and positional restraints that led to his asphyxiation. In a nutshell, he was just simply unable, using all of his muscles of respiration, his chest wall, what we call accessory muscles of respiration, which are extra muscles that will be triggered in the event that you're having trouble breathing. He was trying to get in enough oxygen, and because he was unable to, because of the position that he was subjected to, as we just discussed, the heart thus didn't have enough oxygen either, which then means the entire body is deprived of oxygen.
Mm.
So low oxygen induced by positional asphyxia. Did you consider other possible causes of Mr. Floyd's death?
Sure.
Let's see if he destroys the
I tried,
fentanyl.
of course, to be as thorough as possible, but I focused mostly on two other potential causes. Number one is whether there could have been a primary heart contribution to George Floyd's death. And the second was whether a drug overdose could have caused his death.
Mm.
So, doctor, would you tell the jury what is a primary heart event?
Sure. So a lot of things can injure the heart. For example, if you do not take in enough oxygen, that will injure all the organs, including the heart. When I use the term a primary heart event, I mean something that originated from the heart itself. So for example, a heart attack. All right, one of the arteries of the heart just suddenly got blocked.
No, this is the
completely,
prosecution's
and
witness.
a heart attack occurred.
Heart specialist.
Or, the heart just, without any explanation, nothing else secondary inducing it, went into a serious ventricular arrhythmia. Okay, so the bottom part of the heart, that part that we were talking about that needs to pump blood to the body, suddenly went into a chaotic rhythm all on its own. If any of those things happened, then I would consider that a primary heart issue, not being caused or secondary to something else.
So you considered whether or not Mr. Floyd might have passed away from a primary heart event or a drug overdose. Did you reach an opinion or conclusion to a reasonable degree of medical certainty as to whether either of those two causes explain Mr. Floyd's death?
Yes, I did.
Would you tell us your opinion?
Sure. After reviewing all of the facts and evidence of the case, I can state with a high degree of medical certainty that George Floyd did not die from a primary cardiac event, and he did not die from a drug overdose.
Thank you, Dr. Rich. Would you tell us what evidence or facts, documents, what did you look at to help you to reach that conclusion about primary heart event and or drug overdose?
Sure. The three aspects of the evidence that I spent the most time reviewing were Mr. George Floyd's medical records, the videos, the different angles from the day that he died on May 25th, 2020, and the autopsy report.
So the medical records, the videos, and then the autopsy report.
Yes.
Let's start with the medical records then of those three. Would you tell the jury what you were looking for in the medical records?
Sure. So you get the medical records. It's usually pretty thick, but you take it one page at a time. And at the outset, I was looking to see if he had been diagnosed with any medical conditions. That's sort of the first step. Kind of it's what you do with a patient in the office, sort of what medical problems do you have? And so I was looking to see what diagnoses George Floyd may have previously been diagnosed with.
And what were your takeaways then from having looked at the medical records and done this assessment?
So at that level, I felt pretty confident that Mr. Floyd had three medical problems. Number one, he had hypertension, high blood pressure. Number two, it appeared to me that
this is a good witness.
He have suffered from anxiety.
This is a good witness.
And three,
he's very clear, very thorough. Looks like he's very competent.
Substance abuse.
I don't get nervous. Somebody says he looks nervous. I don't get nervous. Looks good to me.
Did Mr. Floyd have any diagnosis of heart disease while he was still alive?
No.
Oh no, I'm not streaming the whole day. Just till the break, and then I gotta pick up my kids.
The medical records not only for diagnoses of pre-existing conditions, but also
Amen to that.
Amen to that. Medical encounters.
Correct.
And by that you mean hospital visits, clinics, etc.
Emergency room visits. Exactly.
What did you find in that regard?
So this is, in my opinion, was a really important part of the review as well, because every time Mr. Floyd had an encounter with a medical professional, I viewed that as an opportunity to see if there was any signs, symptoms whatsoever, even subtle, that could have indicated, for example, that he had anything going on with his heart. And so at the emergency room visits, he had one prolonged hospitalization. I really tried to take a look at everything. I looked at any opportunity I could to see if he ever complained of chest pain, which he did not. Palpitations, which is a fluttering sensation of the heart.
He's
I
a
reviewed
world-renowned
all the
doctor, though.
documented physical examinations.
So this is one of the top
of his
doctors in the
heart
field.
to see
So
if there were any abnormalities noted, and there were not.
that just
No
can't. This guy
murmurs,
can't be just
nothing,
ignored, though.
nothing found. I looked at all of his labs that get sent to see if there were any.
Of course, that's where the
cardiac
drama's at.
markers,
The drama's
which
going to
he
be
did
on
not have.
Cross.
I
David, you should know we're waiting for
reviewed
Cross.
his
This is
EKGs and
this
his
is
other
BS. We know what he's
tests.
going to say now. We're
I
waiting for
tried to be
Cross.
as
You
thorough
know
as
we're waiting for
possible
Cross.
because I view this as, I view what we do as a clinician in some ways as actually being a bit of a detective.
Yeah, I agree.
And our
Maggie, I
job is to
definitely
try to
agree.
figure out what might be going on, even if it's not overtly stated so in the chart.
Would you tell the jury, by the way, what an EKG is?
Sure, of course. So an EKG is a shorthand for an electrocardiogram. That's the test where you'll see people put these little sticky things on the chest. We call them electrodes. And what an EKG basically is an opportunity at the surface level of the chest, but the technology is so fascinating. It can give you a glimpse into the heart itself to see a whole host of things, including, is there any evidence of any heart injury happening now or previously? Any abnormal heart rhythms? A whole host of other information that we can get from the EKG at that snapshot in time. And then sometimes what we'll do is we'll repeat EKGs down the line so we can compare and contrast and see if anything had changed.
So you looked at all of this medical information on Mr. Floyd, including the EKG. Did you note any cardiac problems that related to Mr. Floyd?
I noted no cardiac problems in the medical records as far as Mr. Floyd's medical condition was concerned, including everything I mentioned, the EKG, even a time where they put him on a continuous cardiac telemetry monitor, which they'll do sometimes just to see beat to beat if anything's going on. I reviewed that as well.
That's their camera, not my feed.
Did you see any evidence of Mr. Floyd having had any abnormal heart rhythms?
His EKG showed absolutely no abnormal heart rhythms. He had that cardiac telemetry that I mentioned that he had on for a few days, did have on a rare occasion something you would call a PVC, which is a very normal finding. I don't know if anyone's ever felt their carotid flutter for a second or something like that. It happens to all of us, but absolutely no ventricular arrhythmias for the duration of the time that he was on the monitor.
And PVC is not a kind of plastic pipe. You mean pre-ventricular contraction?
Yeah, right? premature ventricular contraction.
He's looking at the jury, yeah.
People refer to it as
he's looking at the jury. That's when he looks that way.
A really normal.
They teach you to do that, though.
Drink a little coffee or anything else. You're sleep deprived.
Because that's who you're actually talking to. You're not talking to the lawyer.
You're
talking to the jury.
Totally normal finding. Something that none of you should be concerned about if you feel that from time to time.
So did you find any evidence that Mr. Floyd had any negative heart condition?
There was absolutely no evidence to suggest that at all.
Dr. Rich, isn't high blood pressure an abnormal heart condition?
So thank you for that question, because I think that's an area of confusion sometimes. So high blood pressure in and of itself is not a heart condition. High blood pressure occurs for basically two reasons. Number one, high blood pressure originates in the blood vessels of our bodies. Oftentimes it's genetically determined why our blood pressure might start to go up over time. If you have a strong heart, you can also generate high blood pressures. And so those two in combination. So why? Well, so I'll pause there and can explain more.
Well, did Mr. Floyd have a strong heart?
So every indicator is that Mr. Floyd had actually an exceptionally strong heart because he was able to generate pressures of upwards of 200 millimeters of mercury on some occasions. We talked a little earlier about my role as a heart transplant cardiologist. One of the problems with patients when they need a heart transplant is the exact opposite. Their hearts are so weak, they can't generate a high blood pressure. Their top number might just be 80. The reason why high blood pressure, though, is important, and it is important to treat high blood pressure, is because over time, if high blood pressure goes untreated, 10, 20, 30 years, the impact of that high pressure on the heart can eventually start to become a bit of a problem. So the way I explain it to my patients who come into the office and I talk to them about treating their high blood pressure is I say, remember, the heart is a muscle. So if you go to the gym and you pick up a couple of dumbbells and you start to lift the weights, initially it feels fine. In fact, you probably get a little stronger. Your muscle will likely get even a little thicker, a little bigger, which is exactly what it's supposed to do. And initially, that might actually be a really good thing. But if I came back, 10 years later and said, how's it going? You'd say, man, this is getting pretty tough. And then the muscle can start to tire out. So we do want to treat high blood pressure. I can't emphasize that enough. High blood pressure should be treated, but high blood pressure in and of itself is not a heart condition.
You learn something new every day.
Review of the medical records. You told us that you also looked at video footage in forming your opinions. Would you tell us what you were looking for in the video footage that you examined?
Now, obviously, my question is, the guy had a 90%. One of his arteries were clogged like 90%. How could this guy say he didn't have a heart problem? 90% clogged artery.
Do some cursory.
That sounds like a heart problem to me.
Observation, basic stuff. What did Mr. Floyd look like? Was Mr. Floyd talking? And if he was talking, was he talking clearly, coherently, answering questions appropriately? Did I notice any evidence of abnormal physical exams on the video? Actually, I was trying to look for as well. When Mr. Floyd was walking, did he appear like he was walking without difficulty, or was it looking like he was perhaps with low blood pressure and maybe gonna fall down? I was listening for any opportunity I could to hear. He might say, I'm having chest pain, or I'm having those palpitations or fluttering sensations. Basically doing what I do when I assess any person for a possible medical problem. I was looking for any and all of those possible subtle signs.
And so this is video footage from Mr. Floyd's encounter on May 25th.
Oh.
May 25th, that's correct.
Well, he needs to say that, Fiona. Fiona's answered my question.
Give you any insights into his ability to breathe?
Yes, of course.
And the ability to expand what's referred to as his chest wall.
Yes.
Again, to refresh the recollection of the jury, what is the chest wall?
Yeah, so the chest wall.
I want to see what he says about that, because I'm confused. He's confused me.
Up the bones and the muscles.
Oh yeah. No doubt about it. This person is a strong witness. But there's just like questions now that I had that I just want. I hope they answer.
The chest wall and the muscles and how they interact, along with the diaphragm
he's good.
Inside are the key structures that determine if someone is able to take in enough air and able to get enough out. So if there is, for example, the lungs can be working okay, but if the chest wall is diseased, if the muscles associated with the chest wall aren't able to contract and move and do their job, enough oxygen can't get in that way either.
So doctor, in our COVID world, do you make clinical assessments of your patients in your work life by video?
Yes, actually, that is one of the transformations that we have needed to adapt to this past year. We are getting back to now seeing most of our patients in person, but during the course of this pandemic, to minimize exposures, we've set up a lot of these tele-video visits with patients. And what I came to appreciate is that while there's no substitute to actually putting your hands on a patient, that's still preferable, in my opinion, to really examine them closely. You can get a lot of information off of a video assessment, even physical examination, by looking at, I have them turn their neck to the side and I can see their neck veins, which is an indicator of pressures. I can see their legs to look if there's any indication of swelling, which might be congestive heart failure. Of course, I could just see the patient. I can see how they're breathing. I can hear how they're talking, if they seem breathless or short of breath. So we actually—
No doubt about it. This is a fantastic witness, though. This
via
looks
video,
very competent. This
assessments.
looks like a
Were
fantastic
you able
witness.
to then see Mr. Floyd at the period of time after he was first approached by the police on May 25th, 2020?
Yes.
What were your observations about Mr. Floyd from that initial encounter with the police?
So from his initial encounter, remembering particularly when he was asked to get out of his car, he appeared fearful, but was speaking.
I'm doing good,
clearly,
Chris. Just watching
answering
this.
questions appropriately. Didn't see any acute, what we would call acute distress.
I was sitting here watching it alone, so I was like, hey, you know, why not just do a live stream? We can all watch together.
Low oxygen, for example, or from any active medical problem. And as I said, I was really trying to keep a close eye on some of the subtleties of his appearance and speech and so forth.
Were you able to observe at the point that he was being asked to get into the squad car?
Yes, I was.
What were your observations with respect to that period of time?
Yeah, so I watched him walk to the squad car, and then I was observing an interaction where they were asking him to get into the back seat of the car. I heard him talking about how he was claustrophobic. There were times when he was being, I'm not sure if it was pushed into the car or how it was, had even made indicators at that time that he couldn't breathe. But all of my observations at that point were still that up until the point that he was kind of getting pushed or pulled through the car and ultimately onto
Oh,
the
thanks.
pavement,
I'm glad you're enjoying it.
I also saw no evidence that there was anything active going on from a cardiac standpoint.
No reasonable doubt. Yeah, I don't really see any reasonable doubt as of right now. But I could, my mind, you know, I like to try to keep my mind open to it, but I think the state has rung all those bells. There are doubts, but a lot of people don't know the difference between doubts and reasonable doubt.
Arrhythmia, an abnormal heart rhythm, especially if it was originating from the heart. Oftentimes what will happen is you'll have the heart rhythm that goes abnormal, and you'll go from being like totally fine, like hopefully we all are here today, to instantly dizzy or even passing out. I didn't see any indicators that that was happening. I didn't hear him complaining of dizziness or, again, fluttering of the chest. I couldn't see any swelling in his body. Again, I didn't want to take anything for granted that even from the initial encounter up until that point, what if something developed from point A to point B? And so again, up until that point, I saw no indicators of low blood pressure or anything else abnormal with the heart.
Then turning then to the restraint on the ground that you were referring to, what were your observations then as a cardiologist from your having viewed Mr. Floyd's restraint on the ground by Mr. Chauvin?
Sure. So my observations were that he was restrained in a life-threatening manner. Specifically, my observations was that he was on the ground in the prone position, handcuffed, hands behind the back, a knee on the back of his neck, a knee on the back of his upper.
Thanks for joining. New member. All right.
Hands pushing his handcuffed hands further up into his chest. I observed a knee compressing his, I thought it was his buttocks or upper thighs. And then at various points, his lower limbs, his lower extremities being pinned down to the ground. So that my initial observation was, what is the position, first and foremost, that he is being subjected to?
And did you see at some point in you watching the video that Mr. Floyd went into cardiopulmonary arrest?
Eventually, yes, I did.
Do you know what Mr. Floyd's heart rhythm was when he was taken from the scene?
Well, so in the course of the restraint, I was looking to see if his deterioration.
Yeah, I think he's guilty of at least assault. And
Like
if because that's really what you got to think about. Is he guilty? Is Chauvin guilty of assault? If you can find he's guilty of assault,
is what we call
you may have felony murder.
Ventricular fibrillation, or VF for short, VFib.
But Barnes
When
now
that
agrees with
happens,
me.
The individual
Barnes agrees
will
with me.
look
Barnes has changed his
relatively
mind.
Okay, meaning they're alert.
I stumped Barnes.
talking,
So
and then they will immediately become unconscious. On the other hand,
And just to be clear, Barnes agrees with me about the assault felony
was
murder.
from something else, for example, low oxygen levels, you will typically see that deterioration happening much more gradually and slowly. So my observations were the second, that you could see, at least I could see, his speech starting to become less forceful, his muscle movements becoming weaker, until, of course, eventually his speech became absent. Eventually, his muscle movements were absent. And then, as we later discovered by the heart rhythm, he was in a PEA, cardiopulmonary arrest.
So I'd like to talk with you about two concepts. The one being PEA.
Like, what the hell is Chauvin writing down? They must just give him something to do. Sometimes you do that to the client. You give him like a write whatever you think is important down. But he been writing down everything all day. He writing down a whole testimony there, transcribing it.
And the other one being a thing called a systole.
Mm-hmm.
Then why did the dealer take the fifth? Because it's his constitutional right, baby.
So first,
They have a constitutional right.
Would you tell us what pulseless electrical activity is?
Sure. So pulseless electrical activity, or for short PEA, is a chaotic heart rhythm that you can see on the EKG or on the cardiac monitor, but there is an absence of a pulse. And so it doesn't meet criteria for this asystole that I think we'll talk about in a minute, or for ventricular fibrillation. Ventricular fibrillation, if I'll just use my fingers, is basically the heart rhythm looking like this. Okay, it's this little subtle fluttering, but basically nothing else going on.
Nah, can't subpoena the dealer. He's going to plead the fifth. They trying to subpoena him now,
or anyone,
but he's pleading the fifth.
Who's ever been trained in cardiac arrest. One of the things that will come to mind immediately is whenever you see a PEA arrest, you need to think about what's causing it, because nearly all PEA arrests are being caused by something relatively specific. And if you can identify what that is, it can be reversed.
And what is the most common cause of PEA?
So you might have heard of others talking about the H's and the T's. So one of those H's, the most common cause for a PEA, cardiopulmonary arrest, is hypoxia, not enough oxygen levels.
Low oxygen?
Low oxygen.
What the hell is this?
And what about asystole?
So asystole is the flat line. So, when any human dies, they will eventually go into asystole, where there will be absolutely no heart rhythm occurring, even this chaotic rhythm. That is what we
only the state can offer an immunity.
Flat line. So VFib is this kind of thing. PEA can have a variety of chaotic looking.
That's mean they won't prosecute. Yes, only the state can. That's don't on civil law. We can't regress. That was your whole Floyd argument, right? Remember?
If Mr.
To
Floyd
prosecute is the
in a
ultimate
PEA state,
thing of the state.
or generally anyone.
You can't go back on that now.
PEA reversible.
So it is important to put it into context. So we see PEA cardiac arrests in the hospital all the time. Whenever you see a PEA cardiac arrest, you rush to it, of course, and you begin the protocol. And that protocol is the H's and the T's. And so you give oxygen if you don't think they have enough oxygen. I mean, that's the most critical thing to do. Depending on the other H's, for example, hypovolemia or hemorrhage. If you think they're bleeding out from a trauma, you would rush and give them blood. And we're doing these things, of course, simultaneously because time is of the essence. So we resuscitate patients with cardiopulmonary arrest from PEA not infrequently. Unfortunately, PEA can also be a devastating cardiac arrest.
That's true, right? That's true.
Sometimes it's not reversible.
Dr. Rich, did you see any evidence at all that George Floyd had had a heart attack?
No, none whatsoever.
What about this this notion of something called a silent heart attack?
A silent heart attack. Well, so a silent heart attack, a silent heart attack is sometimes referred if it looks like someone might have had a heart attack, but there were no clinical signs to suggest it. It's a relatively uncommon finding. It tends to happen in patients who have diabetes, because when you have diabetes, one of the problems with diabetes is you lose some sensation in the nerve endings. And so typically when you're having a heart attack, you'll see people clutch their chest. Oh my God, I'm having chest pressure, chest pain. Sometimes diabetics won't have that, and it's possible that they can have a silent heart attack. But there was no evidence that Mr. Floyd had any type of heart attack, a silent heart attack or a non-silent heart attack.
He's killing a heart attack. The defense's heart attack, though, theory is going up in smoke now.
The notion of a cardiac arrhythmia, the fluttering of the heart. I think you referred to as either the VFs or the VTs, ventricular fibrillation or ventricular tachycardia. Right.
They killed the drug overdose last week. The drug overdose died on Thursday and Friday.
No evidence.
They're killing a heart attack today.
When somebody is suffering from ventricular fibrillation or tachycardia.
Anybody who keeps saying drug overdose, they just haven't been watching the testimony. They've destroyed the drug overdose. If you're saying drug overdose, you're saying that based on whatever. You're not saying that based on medical science.
Cardiac death.
Or at least not by medical science that they've put forward. The defense may put something up that contradicts that, but right now, all the evidence is saying no overdose.
Did Mr. Floyd die a sudden death?
Mr. Floyd died a gradual death. It would not be considered the classic sudden death from the standpoint of how you're putting into that context, meaning when people have that ventricular fibrillation, that VF arrest, they literally go from being fine one moment to completely out the next. I don't know what happened. I was sitting next to him and he keeled over and was on the ground. And then that could have been a VF arrest. So sometimes there's semantics in terms of this, but in the case of Mr. Floyd, yes, he did have a cardiopulmonary arrest, but no, he did not. There was no evidence of a sudden cardiac death from VFib or any other malignant heart arrhythmia.
Yeah.
So we've talked about your review of the medical records, and we've talked about your review of the video. The third thing you said you reviewed was the autopsy report and findings.
Yes.
What were you looking for with respect to the autopsy report and findings?
Sure. So
the overdose.
We're talking about the autopsy
every
report here.
Uncivil law, to answer your question.
I actually looked at the autopsy report.
Every single doctor
then I went back
has said this is not an overdose. Matter of fact, because he had a high tolerance. So no one, everyone, and they've literally debunked it. They were like, it's the fentanyl overdose is gone.
When we get an autopsy, oftentimes you'll get it because you're looking, could there be something that we weren't aware of that could have happened?
But that doesn't mean they can't bring evidence. Like the defense can't bring evidence to show he did have an overdose. But the prosecutions, all the prosecution's experts have debunked the overdose theory, unless the defense brings it back.
What did you find?
It's interesting. I think what was most important was not only what I found, but what I did not find. So what I found was that his heart architecturally looked normal. He had a description of coronary artery disease, which I found notable.
Oh, yeah,
as I mentioned before,
I'll send him the link.
He hadn't carried a diagnosis of coronary artery disease. Now, I mentioned that I found it notable. I certainly didn't find it unusual because unfortunately, coronary artery disease is so common. I mean, statistically, not to scare anybody, many of us in this room likely have coronary artery disease. I looked at whether there was any evidence whatsoever that Mr. Floyd could have had a heart attack based on autopsy. So when I looked at those arteries around the heart, I not only looked to see how narrow they were and what the composition of that narrowing was, but also whether there were any platelets or clotting factors or anything else of that nature in the arteries, which is what would be there if there was a heart attack.
And then did you see?
I sent on
evidence of
civil
the
law
platelets
the
you would
civil law I
expect
sent it to you on
see if
Facebook.
Mr. Floyd had a heart attack?
No, there were no description of any of the platelets or clotting factors or anything that would block off an artery. None of the arteries were totally, the word we'll often use is occluded, totally blocked off, which is what happens in a heart attack.
Yeah,
Wow.
I want to ask you about some of your specific findings in this regard, but first, for the jury, would you just tell them whether you excluded coronary artery disease as a cause for Mr. Floyd's death?
Yes, I have excluded that with a high degree of medical certainty.
Now, you talked about looking for evidence of platelets from the autopsy report and that you would expect it to have seen those if he had died from a heart attack, and you didn't see them.
Right.
What else did you see?
Well, so what I also saw was I looked at the heart muscle itself. So not only did the heart muscle itself not show any evidence of any injury at all, which you would see, like what if you mentioned the silent heart attack? What about a few years ago, somehow he had a mini heart attack? You would see evidence of that in the heart. You would see scar tissue, etc. So not only did I not see any evidence of a heart attack, the pathologist did a very good job, in my opinion, actually, of describing what's called the endocardium. The endocardium is the innermost lining of the heart. And that is the most susceptible part of the heart to cardiac injury. Even the smallest of heart attacks will always originate on that endocardium, the inner lining. And the endocardium was not only described as normal, it was described as smooth and glistening, a completely normal finding, no evidence at all of even small microscopic injury.
Were you able, by your looking at the autopsy report on the heart, to tell whether there's any evidence as to whether Mr. Floyd had ever had a heart attack, even going back into the past?
Yeah, no evidence whatsoever of a previous heart attack.
Doctor, what is ischemia?
So ischemia is a reduction in blood flow to any organ of the body. That could be the heart, it could be the kidney, that can lead to basically insufficient delivery of oxygen for a short period of time. And if ischemia continues to occur for long enough, that can sometimes cause some irritability in that organ. But it's important to distinguish ischemia from infarct. Infarct is actually what we mean when we say a heart attack. A heart attack. When a marathon runner goes on a run, their muscles will get temporarily ischemic. When we lift muscles in the gym, and they talk about feeling the burn, that means you are feeling ischemia. You're feeling lactic acid buildup, and that's what ischemia is.
Any evidence of ischemia?
Not on the autopsy, no.
Just like the OJ trial.
About the blood vessels, the arteries, and the plaque that was in the arteries.
Here we go. This is
Were
what I've
you
been waiting
able
for.
to eliminate the occlusions, the blockage in the arteries as a contributing cause to Mr. Floyd's death?
Yes, I'd like to clarify. I saw no occlusions, meaning I saw no complete blockages. There were narrowings. There were narrowings in more than one blood vessel. Importantly, the main coronary artery, it's called the left main coronary artery, there was no description of any narrowings or disease in the left main coronary artery.
Why is that significant?
Well, because that is the very first pathway that blood travels down to then branch off into multiple other arteries. And so left main disease, as we sometimes call it in cardiology, is among all of the vessels, probably the highest risk blood vessel if it were to get blocked off.
So how would you characterize the nature of the then plaque within the artery? Was it soft? Was it fractured? How would you characterize it?
I would characterize it the way that the medical examiner characterized it. I'm not an expert at characterizing plaque at a microscopic detail. But what I did appreciate was the description of what seemed to be not only relatively conventional looking artery narrowings, plaque buildup that we all will eventually get in our arteries, but also in one of the arteries, it was described that there was an element of calcium. And I only mention that because that also indicates that this coronary artery disease didn't just kind of develop right away. It was probably a slow, gradual buildup of the narrowings. And that actually is a very clinically relevant finding in the field of cardiology.
Doctor, did you make any assessments around the size of Mr. Floyd's heart?
Yes, I did.
Would you tell the jury about that?
Sure. So when looking at the size of his heart, not just the size, but the thickness of the heart, it was described as being mildly thick or mildly enlarged. Now, depending on which criteria you use, one criteria would agree with that it was mildly thick or enlarged. Others would suggest that it was in the normal range. I do believe that it was likely mildly thick and mildly enlarged. It is an expected finding in somebody that has high blood pressure. So even though there are some scoring systems that might say it wasn't even enlarged at all, in my view as a cardiologist, I do believe there was just the smallest element of increased heart thickness. And as I mentioned before, that's important because that's exactly what the heart is supposed to do when there's high blood pressure. That is a normal response.
Sorry, that's the loudest the
muscles
video
getting stronger,
video
it's
can get.
allowing the heart to work and work well. Now, if that goes on for, like I said before, 20 years, we can have problems. But early on, having a mildly thickened heart is not only a normal finding in someone with high blood pressure, it may actually be beneficial in the short term.
Doctor, putting all this together, did you see any evidence at all that the primary cause of Mr. Floyd's death originated in his heart?
No, I did not.
Let's talk about a new subject. Whether or not Mr. Floyd suffered from a drug overdose and died from a drug overdose. That was something that you also considered as a cause.
They going through the whole thing.
Are you familiar with Mr. Floyd's
Why the drug
toxicology?
Why not a drug overdose?
Yes, I am.
Okay.
What or which substances did you consider in evaluating Mr. Floyd's toxicology history?
Well, when I was a trainer, I did handcuffing and aspartame. So we did used to tell people it's like a verbal judo.
Fentanyl,
And
as well as the finding of methamphetamines.
My partner, I should say,
if
taught
any,
cops how
do you
to
feel that the fentanyl
avoid
played,
conflict through speech.
in
And it was
the
called
cause of
verbal
Mr.
judo.
Floyd's death?
As far as I can tell from reviewing all of the facts of the case, I see no evidence at all to suggest that a fentanyl overdose caused Mr. Floyd's death.
As cardiologists, do you occasionally have to care for patients?
I might have been talking to my daughter when I
struggle
was
with
talking to the
opioid
mic.
to
Sorry.
opioid addiction?
Absolutely.
Make sure my mic is still on.
So here
Yeah.
you found that the
Mic is
fentanyl,
good.
in your opinion, played no role in Mr. Floyd's death. Would you tell us why it is you hold that opinion? How
No,
do
I
you
think
reach
my
that?
daughter. I was saying something to my
Well,
daughter, and I was muted, and I
would
think
break it
people
down
thought
to
I was
just two
talking.
major reasonings. Number one, it appeared to me that Mr. Floyd, who was an acknowledged frequent chronic user of substances, particularly opiates, likely developed a high degree of tolerance. There's even one emergency room visit that I had reviewed where he came in and he told the emergency room team that, he was tearful and says, "I'm having trouble with substance abuse. I think he said I took 8 Percocets within 2 hours. He had no side effects from that at all. They observed him for a couple hours and they discharged him. And just so looking through, it looked like he had built up a high tolerance just in general to opiates. But the second, and just as important, maybe more important.
So number one is high tolerance.
I didn't see any of the signs of an opiate overdose when I reviewed the video.
So he had taken 8
And
times
when
the amount
you
one time and
refer to the
didn't have
signs
any
of an
symptoms.
opiate overdose,
And then
would you tell the
no
juror
signs
or
of an
describe
opioid
to them
overdose.
What are those signs and what didn't you see?
Sure. So in my experience in the intensive care unit, taking
Need to
care of
object.
patients
You need to hear an
coming with
objection, but
opiate
it's medical
overdose,
records, so they might have gotten it in.
First of all,
It is
they're
hearsay, though.
usually extremely
Out of court statement, or
lethargic,
for the truth of the matter asserted.
oftentimes
Good point.
nearly unarousable. And then you try to wake them up and they're falling right back asleep. They're not talking to you. If they are talking to you, they're often having slurred speech. If they're standing up, which they wouldn't be if they had a fentanyl intoxication and overdose, they would have to imagine get pretty dizzy pretty quickly. I kind of saw all the opposite.
8
with Mr.
pills is
Floyd.
it not
So
8
he was
times? I don't
fatigued.
know. This is
He was awake.
somebody swallowing 8 pills.
He was
You trying to act like that's
He
nothing?
was
He
walking,
popping them like Skittles.
and yet, according
Floyd
to
is
the
popping
toxicology
pills
report,
like Skittles.
he had this degree of fentanyl
That's
in
crazy.
his system. So just looking at the clinical story, I didn't see any signs or symptoms of fentanyl overdose.
I don't know.
Let's
You
turn
guys
to
keep saying drug
methamphetamine then.
overdose. All the doctors are
What
saying
role
no.
do you feel
I don't know.
Methamphetamine,
I don't know.
methamphetamine played in Mr. Floyd's cause of death.
Now we're talking about meth.
I feel it played no substantive role at all.
And why is that?
Well, all considering, it was very relatively low level of methamphetamine in his.
Now I'm pausing this for a second because I do want to say this to everybody. Let's not be naive, right? This guy, we expect this guy to say these things for the prosecution, right? This is a prosecution witness. He's not going to say he died of a heart attack. He died of it. So, there is a little skepticism, and obviously, can the defense counter this on cross-examination? So I just want to make it very clear. This witness is compelling. It's compelling, but just to understand, this is a prosecution's witness who's coming forth. So just keep that in mind. But this witness and all the other witnesses are saying the same thing. So let me go back to playing the video. I just want to make sure we keep that clear. Keep your objectivity when we listen to this guy.
System. And so when you look at the context of the case and you see a relatively low level of methamphetamine in the context of everything else, I felt very confident that that low degree of methamphetamine was not what was triggering this profound cardiopulmonary arrest.
Yeah, it's probably right after these questions. You'll have cross-examination.
So Dr. Ritz, then taking into account all of the evidence that you reviewed, do you have an opinion to a reasonable degree of medical certainty as to whether Mr. Floyd's death was preventable?
Yes, I do.
Would you tell us what that opinion is?
Yes, I believe that Mr. George Floyd's death was absolutely preventable.
There it is. Boom.
Were there critical points in time during his subdual and restraint on the ground when you feel measures could have or should have been taken that would have preserved his life?
Yes, I do. I think there were several junctures, actually.
Would you tell us about those?
Sure. Well, the first, of course, was to not subject him to that initial prone restraint positioning that he was subjected to. I mean, that is first and foremost. So if that was not the case, I don't think he would have died. The second, though, was when he was in that subdual and restraint positioning, and he was stating repeatedly that he can't breathe. And he was getting a little weaker in his speech. There was one moment in the video where I heard one of the officers saying, I think he's passing out. That would have been an opportunity
Speed this up a little bit.
Quickly relieve him from that position of not getting enough oxygen, perhaps turn him into a recovery position and allow him to start to expand his lungs again and bring in oxygen and get rid of carbon dioxide. So in addition to not putting him in that position in the first place, when there were signs that he was worsening, repositioning him, I think very likely would have also saved his life.
Repositioning would have saved his life.
Was there a point
Didn't
in
die
time,
of an overdose.
Dr. Rich,
Didn't die of a heart attack.
Mr. Floyd was
Damaging
checked
witness.
for a pulse when he was in the subdual and the restraint of Mr. Chauvin.
Yes, there was.
Took 8 pills in the
At
past,
time that, he was
survived.
checked for a pulse and he no longer had one.
2 pills found in the
your
back.
opinion as a cardiologist, was there anything Mr. Chauvin could have done at that point in time that would likely have saved Mr. Floyd's life? Well, at the time that Mr. Floyd is
Objection for a leading question.
What is your opinion, for reasonable degree of medical certainty, as to what Mr. Chauvin may have done that would have potentially saved his life?
Calls for speculation.
You can give an opinion.
Just prior to that point, I heard one of the officers actually ask, actually on 2 occasions, if Mr. Floyd should be turned onto his side. And the response was, no, just leave him. And once the officer announced that he did not have a pulse anymore, I think he actually said he does not have one, was the exact words. At that point, the immediate response would then be to not only relieve him of the restraint, but at that point, now you got to start CPR. You got to start immediate chest compressions, because we know that if you can get to a patient right away, even when they've lost.
Oh, because
pulse,
we were behind,
even
so
when
that's
they've
why I
gone
sped it
into
up,
a
and it was
cardiopulmonary
going
arrest,
so slow. So
there is a significant opportunity to save a life.
but speeding it up,
Every minute
you guys can hear it because they
that
talk really
transpires
slow. So I
that
thought
you are not
1.5 would
performing
be all
the
right.
basic life support and CPR measures, the literature would suggest an approximately 10 to 15% less chance of survival. It is why we pour so many resources these days into a community.
Yeah, this is
education
tough.
training
This is
for
tough to get
bystander
over.
CPR, because it's
I'm with
effective
you.
and it works if the person can be tended to quickly enough.
Then from your review of the video, where you can see Mr. Floyd and Mr. Chauvin there on the ground, if Mr. Chauvin knew CPR, did you see any reason from your observation that he could not have supplied CPR?
Not within the opinion of medical opinion, so that is sustained.
I'm sorry, Your Honor.
Sustained.
Um,
Opinion counsel.
so
All right,
that
that was-
then that Mr. Floyd was actually put into the ambulance from the scene.
I really want to
Your
see the
opinion is
cross.
pretty
Like
honest.
all this, we
What
know
would
what
have
he's
been
going to
the
say, right?
prospect
We
of
know what he's going to
participating
say.
in
The jury probably knows what he's going to say. We want to really see the
Opinion if you have
cross. The cross
So at that
examination is
point,
where this is
I
going to
think the chance of meaningful survival, unfortunately, was very low, because I counted the number of minutes that he was on the ground, pulseless, without any CPR. And by the time the paramedics rushed in to get him onto the stretcher into the back of the ambulance, at that point, a lot of time had passed. I give tremendous credit to the efforts of the paramedics and the doctors and nurses in the emergency room. I mean, they worked on him for what seemed.
Sustained. This is non-responsive.
I give credit to the doctors to try to save the man's
As to
life.
whether Mr. Floyd
Yeah, he's giving a speech.
would have lived, if not for the 9 minutes and 29 seconds of subdual and restraint.
Overruled if you have an opinion.
Let me finish my question for you, Dr. Rich. Do you have an opinion as to whether George Floyd would have lived, if not for Mr. Chauvin's subdual and restraint of him for 9 minutes and 29 seconds on the ground?
Overruled. Reasonable degree of medical certainty.
Yes, I believe he would have lived.
Last question, Dr. Rich.
He would have
Do you have an
lived.
opinion as to whether a completely healthy George Floyd, that is, any healthy human being, would have survived the subdual and restraint that Mr. Floyd suffered during the 9 minutes and 29 seconds on May 25th of 2020?
It's sustained is irrelevant as a general person.
I'm sorry, I couldn't hear you. My question for you, Dr. Rich, is would any person, a healthy person, have survived the circumstances or conditions that George Floyd underwent during the 9 minutes and 29 seconds on May 25th of last year?
No.
Sustained.
Oh, sustained. I thought it was.
There's
Medical
take a
opinion.
mid-morning recess. Let's come back at 11:25. Thank you.
Whew, all right. So this doctor more or less told us everything we were going. This was not like a surprise, right? We knew what he was going to say, right? We knew this doctor was going to come and say everything that he just said, right? This is not surprising to anybody, but I think this is blowing up. The defense is going to have a hell of a job. This is blowing a lot of facts at the defense. Let me see what people think in the chat. It was it was relevant, but you know what? When the defense opens up the door, then you can bring it in. So soon as the defense says, well, if he had, if you found him dead in his home and he had, and you had was a heart condition, then you can rebut that. But right now, it's all right. I think they got enough in. The doctor's saying if he was, without the restraint, he would have survived. The doctor's saying he would have survived without the restraint, in his medical opinion. I think that's damning. Steven Crowder created that it was just fine. No, Steven Crowder didn't really recreate it. He didn't recreate it like this one. Remember, on Floyd, the knee was on his neck for 90% of the time. Crowder, he was like maybe in a minute or half a minute or something like that. So Crowder didn't recreate it. If Crowder wants to recreate it, let me recreate it with him. He may not survive. Was this guy trying to suppress? Yes, they're trying to suppress him as cumulative almost, right? Because this is so everybody understands what we're talking about legally, right? We're talking about cumulative, right? This thing is just like if you keep, all right, you got one, for instance, let's talk about like the use of force. One person already, you got the detective, right? This was unjustified. The trainer, the supervisor, the use of force expert, the doctor, all these people, right? You got like 10 people saying this was unjustified use of force. Now you're going to have another expert come and say it's an unjustified use of force. So it's cumulative, right? It becomes cumulative to where it's unfair. So they say, okay, that's unfair. It's not, it's cumulative. The same thing with the medical experts. All the medical experts for, I know a lot of people are going to be upset at this. What can you say? All the medical experts, every single one has said that it was the police restraint and neck restraint that killed them, right? So that's something that you got to get over. But now you got this last one. I'm not sure if they're going to have another one after this, but you're going to have this last one. So it's just, if you're talking about the prosecution's case, cause of death, I think if you're trying to prove the cause of someone's death, and you got 6 doctors up there saying, in unison almost, right, that the cause of death is X, then how can you not say they've at least given you something to think about, right? People are making it seem like they haven't shown anything about cause of death, but they have. I think they have shown something cause of death. It's right. It's there. All these doctors. So I don't know. I think when we talk about reasonable doubt, is it reasonable to doubt the top experts in their field, the top pulmonary, lung specialist in the country, the top heart doctor in the country, the top this guy, the president of the Medical Examiners Association? Like, reasonable? Is it reasonable to think that all of them are just lying on the stand to try to convict this cop? I don't know. That's just not reasonable to me. That's not a reasonable doubt. But to other people, it may be. Any more questions for me? I'm trying to see. Hold on. What's up, man? My daughter's eating pizza. Reasonable doubt, maybe not yet. I just don't. Well, there are two things. There's reasonable doubt to convict, right? That's one thing, right? I'm not talking about that. I'm really talking about enough to get it to a jury, right? Because after the prosecution presents their case, so everybody understands. Listen to me before everybody keeps arguing. When the prosecution ends what is known as its case in chief, right? When they end the case and say, this is our case. We've presented all our evidence. The defense then is going to present essentially a motion to dismiss. And they're going to say, we want to dismiss this case because the prosecution hasn't proven their burden, right? If everything the prosecution is saying is true, they can't legally win. That's what we're going to say, right? That's what the motion is going to be. So then the defendants, the judge is going to have to make a determination. And that determination is going to be based on what we got, right? We got the use of force people saying it wasn't justified. We got the assault. Here's an assault. He intentionally did it. And then we have the cause of death. All these doctors, all these medical experts saying Chauvin was the cause of death. That's enough to, I think, survive the motion to dismiss and force the defense to put on their case. And then the defense has to bring in their experts, right? There's they're wrong, right? They're wrong. And then you make it a battle of the experts. If I was the defense, that's where I'd be going. I'm going for a battle of the experts because there's no way, unless this cross-examination has to be the best damn cross-examination ever on the planet, right? Ever. If he's going to overcome these experts like this. And he's been okay. Don't get me wrong. He's been doing a good job. But I don't see how you get over these experts. These are some really, really good experts. Now, maybe since this expert is new and doesn't really, first time testifying in court, maybe you can stumble him up. But at the end of the day, you got to get him to say something that he don't want to say. And right now he's saying everything the prosecution want him to say. He's just said it. I don't know if you're being, again, if it's reasonable, if we're talking about being reasonable, if I want to know what killed somebody, what's reasonable? What's reasonable? Is it reasonable for me to go to the medical exam? Is it reasonable to go for me to the top doctors in the country? Is that reasonable for me to accept their opinion as to the cause of death? If now you may not agree with me, but I'm just asking you, is it reasonable? Let me know in the chat if it's reasonable. Either way, the city is gonna burn. Yeah, They were talking about that this morning, about the protest, and if there's protest, and how some of the jury. I think the jury should have been sequestered from day one, right? Why is this jury not sequestered? I don't know why they didn't do that. So the doctor is misleading with the 8 perk statement. Well, shit, again, I don't know. I'm not a doctor. I wish I did. Maybe it was misleading. And think about that. He just that blew up the whole overdose thing, right? He threw 8 pills down his mouth and went to the hospital. Was like, yo, I just swallowed 8 pills. Had no ill effects, right? Tolerance level is off the charts. That's 2 pills. So he swallowed 2 pills and has an overdose, but he swallows 8 pills and is all right. I don't know. It's just, people, if you just ask me, am I being reasonable? If I'm trying to just be a reasonable person. Doctor understands that he swallowed 8 pills and was all right. This other guy says he swallowed 2 and he's having an overdose. That just doesn't seem reasonable to me. We're back on. Speedball is like a cocktail. Maybe that is. But again, they went through the meth. They went through all the stuff. They all are saying the same thing. Again, it's not, remember, we're not trying to prove he's guilty, right? Well, they're trying to prove he's guilty. But at this point, we're saying reasonable doubt, right? And so I'm not even saying reasonable doubt. I'm saying what's reasonable to believe. Is it reasonable to believe these experts? Is it reasonable to believe the people at the force? Is it reasonable to believe? Is it reasonable? I don't know. To me, yes. 1 blue is 30 milligrams. Well, you got to, it's funny because everybody is throwing out random facts that haven't been presented here, right? 1 is 30. This is this. Show me where they said it's 30 mils. Show me, it's. I can only go with the jury's being. The jury's hearing certain things, right? And I'm saying, if I'm a juror and I'm hearing what they are hearing, right? They are hearing this. We're all hearing the same thing the jury's hearing, right? There's other stuff that the jury doesn't know. Like some people will be saying, well, the jury, well, he's not the drug dealer is taking a fit. The jury may not ever know that, right? The jury may not ever know that the drug dealer is even in the game, right? Even's going to testify. They may not ever know that, right? So we can only go on what the jury does know. Right now, the jury only has seen this parade of experts, world renowned, right? Top of the field, top of the country. This guy, this last guy. It's and then the question is going to ask: is it reasonable to believe them? I believe I believe that answer is yes. I believe the answer is yes. It's reasonable to believe world-renowned experts in the field. You may not agree with that statement, but I think if you ask yourself in the closed corners in the question, when you look in the mirror or something happens to you and you say, well, if the top doctor on the planet, if I had an opportunity to go to that guy and he gave me an opinion, would trusting his opinion be reasonable? I think it would. Let me see if I'm getting any pushback. Nate the lawyer went the fact that his friends couldn't get him alert, driving, notable symptoms. Yeah. I'm saying yes. And maybe the defense can bring something like that up, right? But if you're telling me my knowledge versus the knowledge of the top doctors in the field, right? It's just like, and no disrespect, certain, a layman's legal knowledge versus mine, right? I've taught at a law school. I got 10 years of Leo experience, right? I was a prosecutor, right? Somebody off the street is going to tell me about the law. Maybe they have some knowledge, but trusting their legal knowledge, somebody who maybe not even have a high school diploma over my legal knowledge, somebody who has this, no. It's like even within the same field, like between me and Barnes, right? Barnes has been a lawyer for a generation. This guy's had more clients. He's probably going to have more clients than I'll ever have, right? If Barnes, generally, if I say right and Barnes says left, I'll agree with Barnes. I'll say, all right, trust Barnes, right? Because Barnes just has that wealth of knowledge and experience that I'm not going to pretend like I know more than Barnes. That's ridiculous. Hell no, I don't know more than that guy. But on various issues that I believe I disagree with him, I'll go look at the issue and say, okay, this is the reason why I disagree. And like now, he's even come like with the whole assault versus the assault felony murder, right? Barnes said one thing. He said I was wrong. I said Barnes was wrong. But instead of just saying he's wrong, I gave a very detailed analysis. Here's the case law. Here's the complaint. Here's what it says. Here's the law. This is why you're wrong. And now Barnes has changed, right? Barnes has said, okay, assault, The underlying felony is assault for felony murder. So Barnes agrees with me now. Barnes has changed his mind, but it wasn't just but I didn't go to Barnes and say, you're a dummy. You don't know what you're talking about. Hell no. I said, well, no, Barnes, and it's interesting because 90% of the time Barnes would actually be right. But except this one time he was wrong, and I told him, and I was able to show him. So that's what I'm saying. It's just, it's the standard here is about being reasonable. And I think a lot of people try to miss that and maybe treating other evidence, things that they may not have heard from the street, but presented with what you got here. The question is it reasonable to trust these experts? I'm saying it is. I was eating fentanyl pain patches. It's on another level from Ferguson. No, I'm just trying to keep it real. Thanks for sharing. Barnes is going to hate me now. Barnes is going, Nate's talking trash. Let me see. I missed the whole 8 pills and going to the hospital. I'm guessing he didn't get a stomach pump. No, since he had his tolerance was they said through the roof. This guy's popping pills like M&Ms. He's popping pills like M&Ms. Popping pills like M&Ms. No problem. Now you find 2 pills on the floor that's half chewed and saying that he died of. Nah. But some people have made great counterpoints. I want to be very clear. I have heard some of the great counterpoints. This was a speedball. It was mixed with another drug, but they've gone through it. Not fentanyl, not meth. This is what you expect. This is what you don't expect. I don't know. If I was an expert physician, if I was an expert doctor, an academic in the field that can challenge what their conclusions are, I would say, I don't believe them because this. But at a point, I got to trust the experts. Unless the defense, which I expect them to do, is going to now cross-examination. I expect to hear a certain couple of questions. Number one, you're not a forensic pathologist, right? That's what the first thing I'm going to bring up. You are not a forensic pathologist, right? You don't do autopsies. So, just to make it clear that this doctor is not specialized in what killed people. That's what I'm going to say. You're not a toxicologist. You're not this, you're not that. So I expect those type of questions, right? You're specialized in a very limited field to try to limit the damage of what he's been saying. You've said this, but you're not specialized in that, right? What do you said this, but you're not specialized in breaking down videos. You're not specialized in this. You only specialized in hearts, right? So yeah, he didn't have a heart attack. Okay. So all this other stuff you testified to, you don't specialize in that. That's how I would attack him if I was Nelson. I bet you that's what Nelson's doing. If Nelson does that, if Nelson goes up and says, well, the specific question is going to be, I suspect the specific question from Nelson is going to be, it's going to be something like, you would agree you're not a pathologist, right? You would agree you're not blah, 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 right? He's going to say a couple of those just to knock that down and say, well, he's not an expert in any of this shit he's talking about. He's an expert in the heart, but all that extra stuff that he's talking about, he's not an expert. You ain't no dentist, right? So why you talking about teeth? Yeah, you ain't no dentist. So why you talking about teeth? Yeah. But that's the way you do it. That's the way you break down this thing. So if he says it, remember. But I don't know. But Nelson's been good. I think any competent attorney, if a competent attorney is watching this, they're going to say he's going to narrow, and that's one thing you have to do on cross, especially with an expert. You narrow that expertise, right? Because right now he's doctor of everything, right? He's talking about causes of death and fentanyl and this and this and this and this, and you're like, damn, the guy just said he was a heart doctor. How the hell we get the fentanyl? Okay, Nelson's got to come and he's got to start narrowing that shit down. You're not a toxicologist, right? All right, boom. That's that whole fentanyl stuff is gone. You're not you don't do all. You're not a medical. You're not a forensic pathologist, right? Boom, right? Narrowing it, and then it limits the damage of what he's been doing. I hope you guys. I don't know if you guys enjoy this or not, but this is how I'm thinking. I would attack it if I was Nelson. Hold on, let me see. I think they're back. Oh no, it's still live. Yeah. All right. Cross-examination sounds more fun. Yes. Also, too, on cross, you got to remember to only ask leading questions. Only ask leading questions. So you want to just ask him questions and have him say yes or no. And for those of you who don't know, and this is going to be great for you guys here, right? This is going to be great for you guys. This is a lesson in cross-examination before Nelson comes up. Think about this. Any law school, if you're a lawyer out there, any lawyer will tell you on cross-examination, it is not the witness who is testifying. It is the attorney. That's why you ask leading questions. The witness is like a dummy up there. Yes or no, yes or no, yes or no, right? It's you as the defense attorney who is testifying, right? Did you do blah, blah, blah? Yes or no, yes or no, yes or no. The question of itself is the testimony. The yes or no is just the affirmation, right? That's the power of cross-examination, the power of the leading question, right? You were wearing a blue shirt that day. Yes or no? Yes. You were driving this red car. Yes. You were in this particular spot. Yes. So that's the power of cross-examination. $10 from Ghost Recon. I've not made a decision on what I think yet, but just because they found 2 partially chewed pills in the car doesn't mean that it was full intake. That's true. Facts. I would also agree with the defense attorney strategy. Yeah. Ghost Recon, you're right up my alley. But again, I may be wrong though. I may be wrong. Let's see if Nate is wrong about what Nelson's going to do. But I'll bet you a penny, right? Let's bet $1 that Nelson's going to come and he's going to first narrow his specialty. You're not a doctor of everything, right? You're a doctor of the heart, so why the hell you're talking about fentanyl? And then he's going to narrow it down. Then he's going to start doing the hypotheticals. Well, hold on. If you found somebody in a home alone, laid on the floor with these type of ailments, what would you think he died of? That's what you do. That's how you get it. But we'll see. Nelson should be back soon. What do they say, 20-minute break? I've been sitting here monologuing for 20 seconds. Anybody want to ask me questions, please just throw it in the chat, because this is why we're doing this, right? So we can have this little back and forth. I tried to get uncivil law in here, but he just wants to watch. I think Nelson will smoke him. David, Nelson's good though. I think Nelson's, but again, I want to see what Nelson's strategy is. But let's see. And if he does this, then you guys know. Let's see, because I predicted what I think he's going to do. But again, I don't know if he's going to do it or not. But I think he's going to do. I think that's what he's going to do. Nate, have you watched Tim Pool saying that Chauvin will get off and the prosecution is doing the case? In my opinion, I don't know. I didn't see that. But hey, there are a lot of opinions. So criminal defense, but now, to be honest with you, I haven't done a criminal defense case in a while though. My last criminal defense case was a while ago. The latest cases I've done is just real civil cases. So I've done everything from property. I have another civil case up now, but we'll see. Here we go. Let's get to it. So remember my prediction for all you naysayers out there. Remember my prediction. What do you think Nelson's going to do?
Actor, you're still under oath.
Limit it.
Good morning, Doctor.
Good morning.
Thank you for being here with us today. Just a few questions for you. Shouldn't take too long. Just to confirm, you're not a pathologist yourself, correct?
Boom!
Cardiologist.
The vast majority of the patients that you treat are in a clinical setting, correct?
Correct.
Meaning they're alive generally when they see
Who is the best lawyer on the planet, right? The first
Can
question.
we agree
How can
that it is a pretty common occurrence that people die
the first question
who have
called it?
arteries that are 90% blocked?
No, sir. Well, everyone dies eventually, but not from the 90% blockage.
People die every day who have a 90% blockage.
People die every day from heart attacks.
Well, there's a difference between a heart attack and heart failure, right?
Heart attack and heart failure, you are correct, are completely different terms.
Okay. So people who have a 90% blockage may have a cardiac event and may die.
As a hypothetical,
Yes.
hypothetically, there are undoubtedly people who have died from coronary events with 90% blockages or without blockages.
Okay. And people may not experience pain, right, as a result of an arrhythmia?
Correct.
And sometimes people have a 90% blockage of the right coronary artery, and a 75% blockage of the left anterior descending artery, and they die, right?
Again, this is a not this case we're talking about.
Exactly. Hypothetical.
In a
But I tell you,
hypothetical case,
hypotheticals,
somebody who
right?
has any extent of coronary disease, including
You guys should pay
the
me to do
descriptions
this.
that you just gave, could potentially die. Sure.
And again, they may have no pain associated with a fatal arrhythmia, right?
Fatal arrhythmias often are not associated with pain, in fact.
You would agree that Mr. Floyd did have coronary artery disease.
Absolutely.
And how is that normally, in a living person, how is that normally diagnosed?
So usually the patient has symptoms. So they will have chest pain or they're exercising, right? If you're an active person, you shouldn't have chest pain. And if you come to the doctor and say, something's not right, every time I try to exert myself or boy, it feels like the
Thanks,
elephant on
Dave.
the chest
Thanks.
is the classic description.
Thanks for all the
So
super
that would
chats,
be
guys.
one
Thank you.
of many possible ways that you would diagnose coronary artery disease in someone who is alive.
May also do a stress test.
Sometimes.
A blocked right coronary artery that can contribute to a fatal arrhythmia.
Anyone can have a fatal arrhythmia with or without coronary artery disease.
And so if a blood vessel is blocked and blood is not getting through that vessel, what happens?
Well, it depends, but I'd like to answer that for you. So in the case of Mr. Floyd, what has most likely happened, based on our understanding of coronary physiology, is precisely because he had a narrowing of up to 90% and it had calcium in it. We know that that developed gradually. And the heart is fascinating in what it does. It develops what's called coronary collateral.
This is a mistake,
which
people.
means
Never let
the
this
body
happen. Never
makes
let the witness give a
additional blood
speech.
vessels.
This is give
So
him a
that if there's
speech.
one
Don't
artery
let this witness
that's
give a
narrow,
speech.
It recruits
This is
and
not good.
builds many more blood vessels to supply blood to the heart. It's actually why
My
you
brother,
are more
Black Guy
likely to
TV.
die
Thank
from
you.
a heart attack if you started with a lesser narrowed artery and the plaque ruptured and blocked the vessel than if you started with a more severe narrowing.
Thanks, Bill
because
Brown,
of
too. I
all these
appreciate it. Thank you.
unbelievable coronary collaterals and adaptive responses that the heart does.
What
over
is
time.
Nelson's error? He's letting the
What
witness
is
give a
safe
speech.
dose of methamphetamine?
Prescribed?
Illicit.
I would never consider any illicit drug to be off the street that's not prescribed by a physician to be safe.
And methamphetamine is a vasoconstrictor, correct?
It often can act as a vasoconstrictor.
That means it constricts the blood vessels more, correct?
Yeah, correct. That's what vasoconstriction means. Narrows them down more.
You understand based on the medical records that there's prior evidence of methamphetamine used by Mr. Floyd?
Yes, sir.
And methamphetamine can cause some changes to the heart in and of itself, correct?
Correct.
In fact, it sort of ages the heart more, right?
I've never used that terminology.
Okay. What does it do to the heart over prolonged use?
Every case is different and it depends what we mean by prolonged use. So 1 day, 1 week, 25 years. Like most things, if you smoke cigarettes for 50 years, you're going to have more problems than if you smoked a cigarette or a pack every once in a while.
In terms of what does methamphetamine do to the heart itself?
Yeah,
So
yeah.
methamphetamine,
Yeah, it's supposed to be yes
if
or no.
used over a long period of time, can sometimes contribute to the development of coronary artery disease, as we've been discussing. It can constrict blood vessels.
It's dangerous for an expert, though. You don't
you
generally
have
don't want them to
kind of
talk.
a
Maybe
host
you're
of
right, though.
different
Maybe you're
effects
right.
on
But dangerous for an
various
expert.
parts
For a
of the body
layman,
and the
yes.
heart.
Experts know.
And there's lots of things that can make the heart work harder and faster, right?
Sure.
I mean, methamphetamine being one of them,
Yes.
vigorous activity being one of them.
Sure.
He's going to
Adrenaline.
go. Yes.
Yeah,
I know where you're going.
We all right now have a lot of adrenaline flowing through our system. Adrenaline is needed for life, for sure.
Increases in adrenaline can cause the heart to work harder and faster.
Yeah, I mean, so adrenaline, which is the lay term for catecholamines, that's the purpose of adrenaline.
Obviously,
is to
this
get
arrest was
more blood.
high adrenaline, right?
When we go and exercise, the purpose of adrenaline.
We know where you're
is so we
going,
can
Nelson.
run, we can jump, and we ask the heart to allow us to do that. Correct.
And have you in your practice worked with someone who has a paraganglioma?
I have had a couple of patients who've had what we call Theochromocytomas, which
You got to
is
say unresponsive. Yes or no? Yes or no? Have you?
In the hip area generally?
No, generally it's actually near the adrenal gland, which is sort of just near the kidneys. But these paragangliomas can sometimes pop up in different places.
And how are they typically identified?
Well, so it depends. If it was clinically pertinent, that's how I diagnosed the ones that I've had. The classic findings are the person who's saying, I'm always having headaches. What is with these headaches? I'm always sweating. Why am I always sweating? And you start to say, I wonder if something is releasing a hormone that can be contributing to that. Other times, like in my opinion, the case here with Mr. Floyd, you'll pick them up incidentally, let's say at an autopsy.
They're also often identified because it contributes to high blood pressure.
It can, that is right.
You have agreed that you've reviewed the medical records of Mr. Floyd, correct?
Correct.
And he has a pretty significant history of extremely elevated blood pressures, right?
Yes.
I think the one you referenced that the top number was over 200.
Yeah, on more than one occasion.
On more than one occasion. And the lower number of the blood pressure was likewise elevated, right?
Yes.
Fair point.
Did you observe evidence that in the medical records that Mr. Floyd was taking prescribed medications to control his blood pressure?
I saw in the records during an emergency room visit that he was prescribed high blood pressure medication. What I could not see is whether he was taking them or not, but it did look like at one point there was a prescription given to him. I think one of them was for amlodipine, which is
You see,
calcium
you
channel
got to
blocker,
control
and one of
this
them was
witness.
for,
Yes or no? This is Dave.
either
That's what I'm saying.
hydrochlorothiazide or
Is that a yes?
Do
You know?
agree that the records that you had for Mr. Floyd were relatively limited? Agreed? I mean, they weren't his entire life medical records.
Is he gonna let him give
I
a
don't
speech?
know when he started to see medical professionals. So for all I know, the first.
Oh, I'm
instance in the
sorry.
records
I
that
can't turn up
saw
the. Let me
was
see. I think
the
this is
first
the
time
live,
he
the highest
started
it
to
goes
see,
here.
medical professionals.
I'll turn down my
So
volume.
how many
Maybe
years
that might help.
past medical
And
records did you
I'll mute
I
myself.
believe
Sorry.
3 or so. I think the beginning of 2018 is when I think they started.
Are paragangliomas ever removed from a person?
Paragangliomas, if they are causing those symptoms that I mentioned, the pulsatile headaches, the sweating, etc., a surgeon would sometimes remove them.
Would you prescribe an amphetamine for somebody who has a 90% blockage of the right coronary artery and a 75% blockage of the left anterior descending artery?
So first of all, I don't typically prescribe amphetamines. I have many patients who have coronary artery disease that are on stimulants, okay, for a variety of medical conditions. So I just don't prescribe them, but I do have many patients with coronary disease who are on stimulants.
Would you?
No, I'll
recommend
unmute
to
myself when
someone that
I got
they
something to say.
use methamphetamines with that degree of coronary artery disease?
I would never recommend that anybody take methamphetamine off the street for any reason.
you aware of the research showing that deaths where both methamphetamine and fentanyl are found
Yes,
occurs at a much
Jacob.
higher incidence?
He's not controlling the witness.
Can you repeat that question, please?
Sure. Are you aware that the research has demonstrated that deaths of those who use methamphetamine and fentanyl have been notably higher than methamphetamine?
Yes or no?
Meth or fentanyl alone, the
Objection.
combination.
Objection, Your Honor, for lack of foundation, assuming facts.
As to assuming facts, that is overruled. Assuming, is it the scope of his foundation? Since the state did ask him for toxicology opinions.
Yes.
But the
And he's not a
reference to
toxicologist.
articles, none of which anyone has seen, is simply counsel's reference.
Overruled this,
Overruled.
Judge. Yeah, of course it's overruled. This is a stupid objection.
I am not familiar with the breadth of the literature looking at all of the different combination of drugs and
Yes or no?
combination.
Don't let him start
versus or
speaking.
improved survival.
So is that a no?
Testified that Mr. Floyd, based on your review of the video, did start complaining of shortness of breath prior to being placed in the prone position, right?
Yes, I heard on more than one occasion he say the words, "I can't breathe."
And if Mr. Floyd had simply gotten in the back seat of the squad car, do you think that he would have survived?
Objection, Your Honor, it's not called for medical testimony.
You may give it if you have a medical opinion as to that.
Overruled to that extent.
So had he not been restrained in the way in which he was, I think he would have survived that day. I think he would have.
This is
gone
why
home
you
or
say
wherever
yes
he was
or no,
going to
right?
go,
Non-responsive.
had he not been
That's not the question I asked you.
subjected
I asked you if he got in the back of the car. I didn't ask you about all
this.
this. This is why you don't
So
let
in
the
other
witness give a
words,
speech.
If he had gotten in the squad car, he'd be alive.
Yes or no?
I think my answer remains the same. Anything other than that scenario that he was subjected to, I have no reason.
Yes or
to
no?
think from a medical.
Is that a
perspective
yes?
that he would not have survived that day? Correct.
And in terms of the prone position, you would agree that the prone position is not in and of itself inherently dangerous.
In an ordinary individual, we were to
This
take
guy's
away
giving a
everything
speech for
else that
every
was going
question.
on,
Ah,
someone
Nelson,
was
you're
just simply
tripping. You
lying
got to
in
stop
the-
this
in the
guy.
prone position.
Stop this.
While there are many patients who that would be inherently dangerous, the average individual, I would agree with you, probably just lying flat in that situation generally wouldn't be dangerous.
Even in the ICU, there are circumstances where people have serious medical conditions where they're maintained in the prone position. Agreed?
In the ICU, when patients are put
Every
into the
Every
prone
question can be answered
position,
yes or no.
it is when
But
it is
This
a
guy gives a
desperate
speech
attempt
for every
to
question,
save
right?
someone from their
now,
lungs
now we hear a
have actually
desperate
developed
attempt.
what we call acute respiratory distress
What is
syndrome,
Nelson
or
doing?
ARDS.
Nelson,
They
you're
have a
killing me here.
ventilator in
No.
to
Is
make
that a yes or
sure
no? I don't have a lot
the
of time here.
amount of
People
air
got to go to
they
lunch.
get, no matter their positioning, will always be enough. And so it's a funny
How much
thing
rope do you
think
want to
about
give
putting someone in a
him?
prone
This guy's
position
giving a
in an
speech
ICU
on a yes or no
respirator.
question.
But because of respiratory physiology, sometimes that will actually help open up certain segments.
Do they
of
put
the
people in the prone
lungs
position to save their
that
lives? Yes or
are
no?
needed for oxygenation.
Now he's
But
giving the whole
it's
speech.
Really important to keep
He's
in mind
educating the jury.
that they are on a respirator every single time to open up those lung airways, and they're usually on sedation as well to keep them comfortable.
And my last question, doctor, is after someone's heart stops, is it possible that they continue to respire?
It is, well, I'm not sure I could answer that with certainty other than to say there are these things that are called agonal breaths. So when I'm in the intensive care unit with a patient who is dying and they go into cardiac arrest, once in a while you will see them take 1 or 2 extra breaths. I'm not sure.
Yeah,
the
that's
exact
the job of the defense
mechanism or
attorney,
the
not to
physiological
have an
trigger for
educated
that.
jury.
So
That's
you
his
could
job to
potentially
not let
see,
him educate the jury.
some extra
Uniblink,
breaths,
you are
for a short period of
correct.
time.
You are
For a
correct.
short period of time, up to a minute?
In my experience, if the heart has completely stopped, I would not expect to see the breathing continue for up to a minute, but I might expect it to be seen for several seconds.
No further questions, Your Honor.
Any redirect?
That was a disaster. That was a disaster. He didn't control that witness at all. It was almost like he was doing it for the
Dr.
cross
Rich,
exam for
you
the
were asked
on
several
direct.
questions that had to do, or at least had as a premise, the blockage of Mr. Floyd's arteries. Is blockage a proper medical term to you as a cardiologist to describe the narrowing in Mr. Floyd's arteries?
So when we try to use a terminology that is not medical terminology, right, to explain these phenomena, the term blockage, I tend to use when the blood vessel is completely blocked. There's a blockage.
You're so right. At the beginning, the first question, right? You're not pathologist.
Floyd,
Just let's that go, but explain everything else away. What are you doing?
I will usually use the term narrowings because the blood is still getting through. In fact, the blood may be getting through just fine. There is no level of narrowing, in fact. Even a totally blocked artery, this is what's fascinating, that develops over time, the territory of blood that blood vessel was supposed to supply can still be getting enough blood because of those collateral vessels that develop.
This is true. They may do more damage on redirect than anything else.
You were asked questions again about paragangliomas.
Mm-hmm.
And I think you told us that those are usually
we know
preceded
that.
by
We know that, but the jury, I don't think, got that because he said it right at the beginning and then let it go, right?
Again, did you hear amongst the various complaints Mr. Floyd may have had about pain, did you hear any of them being a headache?
No. In fact, when I saw that there was a paraganglioma,
not a pathologist,
finding in the
not a
report,
toxicologist,
I actually,
not a pulmonologist, right?
I used that Control F button to put in.
I thought you were a heart person. That's
sure
what
found headache.
the defense attorney is supposed to be on.
Scrolling through all of the records, I didn't find headaches at any point.
When you referenced paraganglioma being an incidental finding on the autopsy, would you tell the jury what's meant by incidental?
Sure. So all of us have things in our bodies that aren't causing any medical problems. But if they're discovered, let's say someone gets a CAT scan for one reason, they might find that there's a cyst on the kidney or the liver. Sometimes we'll even pick up benign tumors.
Now
So
he's
we
back
refer
to explaining it to the
as
jury.
Incidental
Look at him.
findings.
Looking at the
In
jury,
case
using
of,
his hands.
Paraganglioma, the name you would actually call it is an incidental loma. Because we don't think it has clinical relevance, but it was found and described in the imaging, or in this case, the autopsy.
Are you familiar with any of the data as to how many people in the United States have ever died as a paraganglioma as the principal primary reason for death?
To be honest, I don't know the exact numbers. I just know that they are very low.
Yeah, this redirect is
Now,
like
you
ridiculous.
were asked questions
Why do you
about
need to do it? You could have ended
high
this
blood
and been
pressure,
done.
The role and impact of methamphetamine, paraganglioma, narrowing arteries. Can any of those things in of and by themselves cause someone to die without first injuring the heart?
Can you repeat the question?
Yes, what I'm trying to get at, whether we talk about high blood pressure, methamphetamine, paraganglioma, and the impact on the adrenals, narrowing of the arteries, can any of those things by themselves cause a person to die without first impacting the stoppage?
Yeah, they are getting confused.
Well, the reason I asked you to ask the question again is because I want to make sure that I'm precise and clear here. High blood pressure can cause death in manners outside of the heart. For example, it can contribute to a stroke.
Now, this is a problem for the prosecution. He asked the question he didn't know the answer to. That's something you're not supposed to do. He just did that, and now the witness is trying to clean it up. He asked the question. The prosecutor just asked the question he did not know the answer to. The witness is cleaning it up now. That's what you're seeing now.
Most of the time, if death is going to occur by them, it's going to be caused because of their impact on the heart.
And did Mr. Floyd have an aortic dissection?
No, he absolutely did not, based on the review of the autopsy.
Didn't have a stroke?
He also did not have a stroke.
So again, just to be clear for the jury, with all the discussion about the narrowing of arteries, meth, etc., was there
He needs
any
to.
damage at all observed to Mr. Floyd's heart muscle?
Based on my review of all of the evidence, the EKGs, the autopsy report, I found absolutely no evidence at all of heart damage in Mr. Floyd's heart.
Thank you, Dr. Rich.
Any recross?
All right, Nelson's got one more shot. Let's see what he does.
On redirect, you were asked a question about the paraganglioma, the coronary heart disease, high blood pressure, if any one of those can cause death independently, and you answered relevant to the high blood pressure, right? But you would agree that when you combine a lot of factors, you would agree that the body is, a lot of things are happening at the same time, right?
Yeah.
Finally, you got a yes or no.
You have a paraganglioma, you've got an increase in the fight or flight kind of response, you've got coronary heart disease, you've got high blood pressure. All of those things combined could cause death, even if there was not a physical restraint.
Well, there's
Yes or no?
paraganglioma. The likelihood that his paraganglioma was even releasing any hormone is highly unlikely.
I'm not asking you to explain it.
The combination.
Yes or no?
The drugs, the high blood pressure, take the paraganglioma out of it, right? The increase in adrenaline from a struggle with officers. All of those things combined together, even in the absence of prone restraint, could have resulted in death.
Yes or no? There it is.
Upon my review of the evidence and
Yes.
facts of the case,
Get him.
I
Stop him.
found no evidence to support that.
Fair enough.
That's not
Thank
the
you.
question, though.
Right.
That wasn't the
Thank you,
question.
Doctor. Thank you.
He's answering
Yours
another
too.
question. You think that's not my question? Ah, Nelson.
And we have our next witnesses at 1:30, is that correct? All right, we have two witnesses for this afternoon, members of the jury, and counsel and I have to finish up some legal issues.
Nelson,
at
you got to
1,
say that's not my
so we're gonna
question. I didn't
break
ask
until
you that.
1:30.
I asked
Have
you
a good one.
something very specific. Yes or no. That's it, right? And you can see Nelson was trying to stop him. He was trying to stop him. He was trying to get me and stop him. He's like, give your speech and let's go to lunch. It's like, no, Nelson, don't let him give a speech again. Oh my God. Nelson. He had him on the ropes. He just had to say no. Yes or no. That's it, right? I didn't ask you that question, but that last answer was to a question Nelson didn't even ask him, right? He answered another question. No. I asked you a very specific question. If we remove the police restraint, blah, 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 could that have killed him? Yes or no? I didn't ask you about what happened. I'm asking you about this, a hypothetical. Yes or no? That's it, right? I don't care about all this other stuff. I'm asking you a simple question. That's why you ask leading questions on cross, right? Now, I know people are going to say, well, Nate, that was this, and that's unfair because but that's not your job. Your job on cross is just to get situations out there. And I think Nelson had a nice opportunity, but I understand he didn't want to struggle with this guy. But, you got, and he did try, let me roll it back, because at the end, you can even tell he did try to get that yes or no. Like he was yes or no, but he stopped himself though.
Releasing any hormone.
The drugs, the high blood pressure.
Now listen.
Take the paraganglioma out of it, right?
Listen.
The increase in adrenaline from a struggle with officers. All of those things combined together, even in the absence of prone restraint, could have resulted in death. Yes or no, sir?
That's now you had as soon as he says that, you got to hold him to a yes or no answer, right? You've laid it all out. He understands what you're saying. You said yes or no. Now watch what happens. Does he just hold him to that?
Upon my review of the evidence and the facts
Now you saw Nelson was trying to stop
of
him.
the case, I found no evidence to support that.
Fair enough. Thank you.
I know you found no evidence to support that, because that wasn't my question is about what evidence you found. It was about my hypothetical I just threw at you. So again, maybe you didn't hear the question. Blah, 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 blah. It's a yes or no answer. We got to go to lunch, right? The judges want judgments to go to lunch. Just yes or no, please. Blah, 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 blah. What? No. Yes or no. I don't know. I just may be a bad lawyer. Thank you for the $5. Thank you for the $5. I appreciate it so much. Hope this witness did the eyebrow move. So what do you guys think? What do you guys think? Was this good? Was this? Thank you for the dollar, Chase. Things. Was this good? Do you guys? You know, I know I get a little animated with these things sometimes, but I really thought Nelson had his win. Like at the end, he really had it. He had the grasp on it. He just didn't control the witness. He didn't control the witness, and the witness gave a speech. So before I get out of here, my prediction came true. Right? My prediction was, matter of fact, it didn't come true a little bit. It was dead on the money, right? The first question he asked was the question I told you he should ask, right? Early, right? You're not a pathologist, except he didn't go through the whole, I went through the whole thing. You don't know what you're talking about when we talk about, you're not a pathologist, right? Obviously, you don't do toxicology, right? You're not a pulmonologist, right? So let's just make sure you're a heart doctor, right? So when you say, this stuff about text, that's how you control the witness. That's how you limit the damage. And that's how you get in and you get out. That's what they tell you. Get in, get out. Don't let him give a speech. When he starts giving speeches, no. Yes or no. I don't care about your speech. I care about what I asked you. That's how you got to do it. In and out, in and out. You get in, get out. Let him explain it on redirect. And you start strong and end strong. I think he tried to end strong. And then he saw he had him and just was like, I'm not going to struggle with them. Let's go to lunch. No. I think he could have done better, but this is you pick and choose your battles. Maybe he said, I'm not going to choose this battle. All right, guys. Well, listen, thank you guys so much. Let me see if I can run out these super chats. Any last little super chats I got left? Any last little questions? All right, this one. You're going to do this more of the case. I don't know. I'll probably do some more of this. When I have some time, because I was working, but now my daughter was out of school, so I'll probably do this again tomorrow if you guys like this. I think 400 people watching this, so yeah, he was really confusing. Yeah. Well, I don't know. I'm just it's interesting watching someone else do it instead of you doing it, right? Because when you watch somebody else do it, you're like, and don't get me wrong, Nelson and all of them are fantastic attorneys. This is a Monday morning quarterback. It's easy for me to sit here in my chair watching them. It's tough when you're in there in court and stuff is all on. You know what I mean? It's that's a different. When I'm up there, I would have probably made those same mistakes. So I don't want to make it seem like I'm impugning his legal knowledge or his how good he was or how good he is. I'm just saying, looking at it from here, you guys will see it, and hopefully you guys understand why I'm thinking what I'm thinking, why I'm coming to the conclusion I'm talking about, why I'm saying this is what's happening. So listen, don't forget, on your way out, if you're watching this, hit the like button, so the YouTube algorithm does this thing. If you haven't joined yet, you can definitely join the channel. I'll be doing this tomorrow. I'm going to probably start a little earlier, maybe 10 o'clock, so we can I really want to see the defense's arguments, and we'll see if we can go through the motion to dismiss. My name is Nate the Lawyer. Thank you guys so much for joining me and watching this part of the morning. I got to get out of here, but I'll be listening to the rest of the trial when I'm picking up my kids, and I will see you tomorrow. Thanks again for all the super chats. Thanks for all the love. My name is Nate the Lawyer. I'm out of here.